Top 7 Facts about Panic Attack and How to Deal with It. Panic attacks can be a terrifying experience, often mistaken for a heart attack or a feeling of impending doom. They are sudden episodes of intense fear that trigger severe physical reactions when there is no real danger or apparent cause. The first fact to know about panic attacks is that they are more common than you think. 1 in 10 individuals will experience a panic attack at some point in their lives. That's a staggering number, considering the severity of the symptoms. Speaking of symptoms, they can vary from person to person. Some might experience racing heartbeats, others might deal with dizziness, nausea, or a sense of unreality. Regardless of the form they take, these symptoms are usually intense and sudden. Panic attacks are not necessarily indicative of a mental health disorder. They can be a one-time event or part of a larger syndrome such as panic disorder, social anxiety disorder, or post-traumatic stress disorder. But, just because you've had one, doesn't mean you have a mental illness. Contrary to popular belief, panic attacks are not just stress-induced. They can occur out of the blue, at any time, even in your sleep. However, some triggers like significant life changes, caffeine, and certain medications can increase the likelihood of having a panic attack. While panic attacks are not dangerous physically, they can certainly wreak havoc on your mental health. Frequent panic attacks can lead to panic disorder, which in turn can result in phobias or lead to depression, substance abuse, or suicide if not treated properly. One of the most effective ways to deal with panic attacks is through cognitive behavioral therapy, or CBT. This type of therapy helps you understand and change thought patterns that lead to unwanted behaviors or feelings. It can be a powerful tool to reduce the frequency and intensity of panic attacks. Mindfulness and relaxation techniques can also be beneficial in managing panic attacks. These methods can help you stay grounded in the present moment and reduce the severity of your symptoms. They're a great addition to any treatment plan and can be practiced anywhere, anytime. Healthy lifestyle habits like regular physical activity, adequate sleep, and a balanced diet can also help manage panic attacks. Remember, our minds and bodies are interconnected. When our body is healthy, our mind is more likely to be healthy too. Medication can also be an effective tool in controlling or reducing symptoms of panic attacks. But remember, medication should always be taken under the guidance of a healthcare provider, as they can come with side effects. Lastly, remember that it's okay to seek help. Reach out to mental health professionals. They can guide you in understanding your symptoms and provide the right treatment options. You're not alone in this struggle. Millions of people grapple with panic attacks, and there's a whole community out there ready to offer support and understanding. In conclusion, while panic attacks can be incredibly overwhelming, there are many ways to manage and treat them. Understanding them is the first step towards regaining control over your life. Remember, you're stronger than your fear. Don't let panic attacks define who you are.